Some people would like to know what is the overall process from start to finish with a hair transplant. Basically, once someone reaches out to our office and contacts us, generally speaking, we like to see them in person and sit down together, discuss their age, the course of their hair loss over the last several years, and what their expectations are, what their hopes are. And once we have all that information, we can go through what the options are, which usually involves a combination of medical therapy and maybe surgical therapy, depending on the specific situation.
There are a lot of non-surgical options for hair restoration. The number one thing is when patients come in to see us and they have questions about thinning or loss of hair, is that they should be evaluated by their primary care physician first, and making sure that we can explain a possible cause and trying to reverse that. That can be very important and stop the process right then and there. When we move beyond that, we talk with people about medical therapies such as Finasteride, which is an oral medication, or Rogaine, otherwise known as minoxidil, is a shampoo. Both of those things are proven clinically to be effective in thickening the hair and promoting restoration of hair follicles that are still alive. Then we move beyond those things to less invasive hair restoration treatments where we can inject the scalp with a product that will actually promote the growth of hair follicles that are still there, as well as thicken the hair that might be thinning.
Once we've decided that a patient is an appropriate candidate for a surgical hair restoration, then we have two basic methods that are available. One is called a follicular unit extraction technique, where hair follicles are removed one at a time and placed into the areas that are thinning. Then that hair gradually over the next year will start to grow and thicken. The other method is hair is taken out as a strip of hair, and that hair is then divided into individual follicles which are transplanted into the area that is needed to be thickened. Both techniques work very well to thicken the hair and to create more hair, but it's also dependent on what the patient prefers and the consultation that we'll have in the office. The transplant itself takes anywhere from 2 or 3 hours for a small session to up to 8 hours for a large session. They're completely numb, so they don't feel any pain at all. It's not an uncomfortable process, but it is a little bit of a long and laborious process. And then there's some instructions that we review on how to take care of things for the next week and next month. And then there are multiple follow-up visits over the course of the next year to assess the results and make sure things are progressing in the way that we want them to. It's really important to understand that there's a whole process that the hair follicle goes through when it's transplanted, and it can take anywhere from 3 to 12 months for that follicle to start growing and to grow in. And so usually we assess results, final results, at about 1 year, but even sometimes from 12 to 18 months we'll see some improvement.
Expectations should be realistic based on how thin a person's hair is to start with and how much hair we're transplanting, but we should expect that a significantly high percentage of the follicles that we do transplant should last, should live, and should continue to grow hair. The techniques for hair transplant have come a long way over the last decade or two, and when they first began doing them, it's very different than how we do it now. Now we have very natural looking results. Hair loss can affect both men and women. It can be something that's very difficult to handle emotionally and can take a big toll on someone, but there are options available. The proper hair restoration technique is decided upon during the consultation, and if done correctly, can be a life changer for some people as far as the amount of confidence that they can regain and just belief in themselves and so forth.
People come in and they've got thicker hair and they're just confident and it looks good, and they're really excited and happy about it. So it brings us a lot of satisfaction as well as clinicians to take care of these patients and to see what a good hair transplant can do for someone.